hence the alternative bill that I'm putting forward for next month. But let's go to the questions. Raise your hand up in the back, right here, sir. White shirt, go ahead.
Both the best in American healthcare and maybe in some ways the worst. Hello?
There we go.
Okay. I'm 67 years old, and I feel if someone were to look at me, I'm in extremely good health. I am. But what you don't see is I've had 2 hip operations, 2 shoulder operations, an ACL, some toes. Unfortunately, my occupation of being a tennis professional didn't help. But aside from that, I'm lucky because I was able to get the best of care from the best surgeons that I can run like you wouldn't believe, play like you wouldn't believe. But that isn't going to be available if this is passed to my brothers, my sisters, many of those in this audience. You will wait unbelievably long. I lived in Europe for many years, and their health system, I'm sorry, it does not compare. The other side of it is, you mentioned Medicare. Prior to becoming on the Medicare dole, or whatever you want to call it, I had to have shot. Beg your pardon? Yes, it is. Dole. I said dole. I did say dole. Excuse me.
Sir, if you could just...
All right, in any case...
Just hold on one second. I want to make sure that we're not interrupting everyone, because we're going to have supporters and opponents, and so make sure.
I don't mean to be long and drawn out, but I want to draw the contrast between Medicare and the private. When I had a shot for my back from extreme scoliosis or whatever, from tennis or whatever, the cost of that was $7,000. Medicare, the same thing, was $1,000 after I had to have it done again and I passed over into that stage. On the one hand, I felt that the insurance was paying too much. On the other hand, I found that my physician was being, screwed. There's no way $1,000 could have paid for what I had done to me. So there you have the yin and the yang of the situation with Medicare.
I thank you for your thoughts, and would just say that one of the concerns about the government is it's regularly out of money. And so then if we put it in charge of your family's health care, we're putting an institution that regularly runs out of money in charge of a critical aspect of our family life. When we look at Medicare right now, Congress is already looking at a substantial reduction for physician reimbursements. Jay, how much is it this year?
Well, cardiology, sites,
A 21% reduction in physician. One of the things that I've seen in the 10th district, but and also Dr. Povados is here. Everybody, round of applause for him. He's one of our. One of the things I worry about is in the 10th district, we're beginning to see physicians not accepting Medicare assignment. The reimbursement rates are so low that they stop accepting that. If this cut goes through, I think we would accelerate that trend. A number of members of Congress and I have signed on to efforts to not allow that Medicare cut to go forward. But that will take resources away from the bill that we discussed, and which is why I worry that we can't afford to do all of these things. Go ahead, Richard. We're going to go by Lord of the Flies rules too, where you have to have the cons.
My name is Kevin Callahan. I'm an American citizen, and I live here in Arlington Heights. Just to preface my question, because I do have a specific question, before I came to Illinois, I lived in Canada in the province of Quebec for 18 years. I honestly don't understand why President Obama has been apologizing for comments made about the Canadian system, because it's all true. That's a joke, you can laugh. Thank you. In H.R. 3200, one of the things that concerns me is the clause that would sunset ERISA after 5 years at the most, and replace it with bureaucracy panels that would then say whether or not a company's healthcare system was acceptable. And actually these panels could keep people from signing up for the company's healthcare system if they didn't approve. In any legislation that you support, could you tell us that you would not allow for such a bureaucracy to interfere with our healthcare?
Absolutely, and you bet. We are all learning terms very important in this healthcare debate, and one of the terms we need to learn is ERISA. ERISA is the fundamental law which underlies employer-provided healthcare in the United States, covering roughly 170 million Americans. You know the key phrase in healthcare, do no harm. The one thing I want to make sure this legislation does when we go forward is does not dump any Americans from the coverage that they already have. And I'm very worried that even under the CBO score of HR 3200, the Congressional Budget Office score, it says that 15 million Americans at a minimum will lose their coverage, and I think that's the wrong way to go. Right here.
Thank you. I just would like you to clarify that everybody who's a non-citizen is not illegal. But leaving that aside, I'm interested to know in your proposed bill, you talked about not letting the government get between patients and doctors, which I think is laudable. Do you have that same provision for not letting insurance companies get between patients and doctors?
We don't. What we want to do is make sure you have more and more options for insurance coverage. So right now, under our law, you are only allowed to get coverage from an Illinois insurance company. I think you should be allowed to buy from any state in the union. Hey! But I'm also worried that the government does not have a stellar record in customer service. So right here, right here.
My name is Marilyn Siegfried.
Oh, hold on one second. There we go.
My name is Marilyn Siegfried. I'm from Schaumburg. And I don't hear anything mentioned about pharmaceuticals. Of course, the pharmaceuticals, many senior citizens are no longer purchasing their medicine because they can't afford it. And I think that goes along with health care, and it should be addressed in the package.
It is, and we have passed a number of provisions of law. For example, the new Medicare prescription drug benefit, or other provisions allowing a rapid acceleration of transfer of medicines to lower income folks to address that problem. But I also want to make sure that we are continuing the pace of medical innovation in the United States. Because right now, for example, I work very closely with the Juvenile Diabetes Research Foundation. We feel that we are on the edge of a cure for juvenile diabetes. If we wipe out all of the incentives to do medical research on the private side, we will lose substantial momentum in cancer, in heart disease, in juvenile diabetes. My job, I believe, as a public official, is to make sure you have as much treatment as possible today, but that 20 years from now, it will be much better for you and your kids. And so let's go up, right in the back, sir. Yeah, I'm going to rotate between back to front.
Thank you, Representative Kirk. You suggested, this question is to tort reform and liability laws, and about if we have tort reform, it'll reduce healthcare costs. But a study that I read about by the Center for Medicare and Medicaid indicate that costs as measured by medical malpractice premiums only affects healthcare costs 0.58 of 1%. And that CBO reports in 92 and 2004 indicate that defensive medicine, where doctors order a lot of tests, are really done to gain revenues from those tests rather than anything else. Could you comment upon those two items?
I am a staunch opponent of the trial bar and want tort reform in the United States. I think that we have roughly $100 billion in litigation costs and $300 billion in defensive medicine. But I don't know, you guys want to, Jay, you're quite eloquent on this topic.